we are here to talk all things skin condition. I don't even want to say skin conditions, like vein conditions and lymphatic conditions that are really common for women. But before we dive into that, we do need to talk on our summit coming up because it is
1 month out.
1 month out at this point. So we are obviously, if you've listened to the podcast before, we are hosting Unstuck, which is a women's health and hormone summit, all about thriving in midlife. It's going to be a lot about kind of reclaiming that relationship with self. I think a lot of women lose that confidence and that just like knowing themselves in that time in life. And we become people that, live for others, our family, our kids, our spouses, our work. And so it's a lot of it's going to be around mindset. And then the other half of it is going to be all things functional in that phase of life. So hormone replacement therapy, metabolic dysfunction and weight loss resistance that happens in that time of life and exercise in that time. It's just going to be really, really cool. So September 5th and 6th in Arlington Heights. We have an awesome location. We're doing, catering a lunch on Friday. We have VIP tickets still available, which are going to be awesome. You get to do dinner with all the speakers and our team. And it's just going to be really, really cool. As we get closer and we're like solidifying the schedule, we're solidifying all the little details. I'm getting more and more excited and stressed and at the same time. It's great.
And I've been like messaging all of our vendors and sponsors, like, can you make sure that you're getting all of this stuff to me ASAP? Because I want to get these goodie bags and gift bags put together for everyone. And we have to draw out like the seating chart and all this kind of stuff. It's like basically planning a little mini wedding, but it's going to be really, really good. And people have asked us about virtual. We are not doing virtual. And the main reason for that is hosting an in-person event is the purpose to be in person for community. So, I mean, we know that many people, it is a lot, to travel, but it's really, in our experience, worth the investment. Sitting at home and watching behind a screen is just not going to be the same, especially with the vibe that we are trying to create. And then, all the technical difficulties, I think, would just add another layer of stress. So it is not going to be available live streamed. We might have some recordings and things like that, but we won't know until after the event, right? Because what if we think that everything's working beautifully and then on the other side, it's like, oh dang, the sound wasn't really great or just whatever. People were being loud, having rappers around.
And then also like someone probably needs to manage the live stream. Like if people have questions on the live stream, it's too much. And so but it's coming up quick and we're super excited. If you have any questions, please feel free to reach out to us. If you want to sign up for the event, go to the show notes. There is a discount code there for listening to the podcast. So hope to see you there. So today we are talking on different types of lymphatic disorders, spider veins, venous insufficiency disorders. So we're basically going to touch on all of them and how they kind of differ and then how you can approach each one of them. And you'll notice that the approaches for each of the one of them are kind of similar and overlap in ways because a lot of them have to do and come back to inflammatory disorders, venous insufficiency, lymphatic drainage issues. So we're going to talk on spider veins, cellulite, edema, lipedema, lymphedema. And we'll talk about lipidemia, which actually doesn't relate to these, but we need to clarify that because it sounds very similar to all of them, but it is not a skin condition or like an appearance condition.
All right, if you're dealing with water retention, you're waking up puffy, your ankles or your wrists are really swollen, or you can't get your rings off, and maybe you're even dragging throughout the day, no matter how much water you drink, there's actually a good chance that you're not actually hydrating properly.
Exactly, because water alone is not enough. You need electrolytes, you need sodium, potassium, magnesium, because those things actually pull water into your cells. Otherwise, you're basically just flushing it out and wondering why you're still tired, you're still bloated, and you're still sluggish.
But here's the thing, most electrolyte supplements out there aren't helping you in any way because a lot of them contain things like natural flavors, food dyes, and maltodextrin, which can irritate your gut. And these things can also spike your blood sugar when you're trying to heal.
That's why we both started using Buoy. It's super simple, just trace minerals and electrolytes in liquid form. No flavors, no colors, no sugar, no sweeteners, and you squeeze it into whatever you are drinking. Water, coffee, tea, smoothies, you name it.
And it's clinically backed by science too. So studies have shown that buoy helps you hydrate better, 64% better in fact, and that's data coming from key blood and urinary markers, not just marketing fluff. And honestly, you can feel the difference. I've had many clients tell me their digestion's improved, they have less headaches, and they're better energy throughout the day.
And buoy isn't just for people that go to the gym all the time and sweat a bunch. They actually offer a 35% lifetime discount for anyone that's struggling with chronic illnesses. Things like POTS, Hashimoto's, Crohn's disease, chronic migraines, and every autoimmune condition. They're really committed to making better hydration accessible to people who need it most.
I actually throw it in my coffee every morning because it's such an easy upgrade. You don't even taste it, but you're definitely gonna notice if you miss it.
If you're tired of playing hydration roulette and want something that actually supports your body, you've got to try buoy. It's honestly one of the simplest ways to feel better faster. So yeah, we're going to start with spider veins because I think that these are probably one of the top most common. I would say spider veins and cellulite are more of like I don't want to say lower hanging fruit, but they're more common for people. They're not as extreme of conditions. They can turn into extreme conditions. Spider veins can lead to varicose veins, which can become really, really painful. But spider veins are basically tiny dilated superficial veins visible under the skin. So you typically see them, they're either blue, they're purple, they're red. I got these when I was pregnant with Taylor. So I have never had spider veins or dealt with them. They can have a genetic component to them. But I had them when I had Taylor towards the end of the pregnancy, and they actually went away after I had her. But they're basically a sign of poor venous return, weak vessel walls, and impaired microcirculation. So they usually happen, one, hormonal shifts, aka why they happen in pregnancy often, mainly with estrogen, but also progesterone. They relax the vein walls, which make it easier for this to kind of happen. Pregnancy and weight gain and blood flow increases the pressure in that time. So when you are pregnant, you have a higher blood volume, so it increases the venous pressure. When you're overweight, you increase venous pressure because of the extra weight. Poor circulation or prolonged sitting and standing, and then genetic connective tissue weakness. Okay. So the crazy thing, as I was researching this, hemorrhoids are similar in some of these. So they occur because of varicose in the rectum.
Yep. Yeah. So when you think about blood flow and a lot of what I understand from hemorrhoids and even like anal fissures and things like that, when you're applying so much pressure, or there is so much pressure already because you have stool that can be up to like 15 pounds, like sitting in your colon, right? Like pressuring on all of that. It's the same way that it would be if you're just walking around with a bunch of, water retention and all of that. And here's the thing that I will say in terms of the spider veins and even like varicose veins, a lot of it can be genetic. So for me, I experienced it. My mom, like I remember, and even my sisters, both I can see on their legs have these varicose veins, and kind of started as spider veins in pregnancy and whatnot. So it is most common to be on the legs, but it can obviously develop in other parts of the body, including your esophagus, your liver, or your stomach. And then in men, they can also develop in the testicles, which is really interesting. So what do we do? How do we improve your blood flow, your circulation? I think anything that we're going to say today, a lot of it is going to be the same: dry brushing, rebounding, getting your blood flow moving, right? If that is cycling, it's walking, it's jumping up and down, box jumps, walk, whatever it might be for you, walking an incline, right? Whatever you are able to do. You can also do leg elevation. So one that I really like is just even laying on the floor, putting your feet up on the wall. That can be really good. Compression stockings, that's obviously just not going to be super comfortable. You guys have also talked, or probably heard us talk a lot about cold exposure or shock therapy. So where it's like hot, cold, kind of going back and forth, contrast therapy there. A lot of this is because it's going to support the vasoconstriction and lymphatic flow, but it's also going to help pull water into those areas. So like if you were somebody who's really struggling, with constipation, I've talked a lot about abdominal massage, but also in a cold shower, getting the water, pointing to that region. This is going to be the same for your legs. And unless you're doing a cold plunge where you're sitting in a tub, you might just be doing a cold shower and you're not really getting, on those areas. What I would do and what I have done is I would do my cold therapy and my dry brushing in the shower. This would not be dry brushing, obviously it'd be wet brushing, but I would be focusing on supporting that lymphatic movement while I'm in the shower, and the cold water is addressing these areas because again, you're not like sitting in it and fully immersing. You can do other things to strengthen the vessel walls. There's a lot of things that are going to relate to the hemorrhoid stuff that I've put together in the past, but when we think about spider veins, this can also, indicate that there needs to be more elasticity, right? Weakened collagen elastin. So we can support with those types of things in terms of, high dosing collagen, collagen peptides, different things like that. But a lot of the really key nutrients are going to be other minerals. So magnesium, potassium, vitamin C, or bioflavonoids. Those can help the synthesis of collagen and vein integrity. You can also do grapeseed extract, which can help strengthen the capillaries and reduce leakage. There's others that I've put in herbal supports, but we think about horse chestnut, butcher's broom, and then Gouda cola. Those all can be helpful for improving venous tone, lymphatic flow, and then reducing, swelling and things like that. So those you could always look at. This is all going to go hand in hand with thinking about your diet, your drainage and detox pathways, right? Are you pooping every day? Are you adequately hydrated? A body in motion will stay in motion. And so if you're somebody who's not, moving your bowels every day, you're not flushing toxins out of your body, you're not going for walks, you're not sweating, you are probably going to struggle with these, even more. And then when we think about, as Becca mentioned before, your hormone balance, right? Your gut microbiome, like what in the body is clogging up your drainage and detox pathways that then is maybe allowing you to become more estrogen dominant. That is going to impact this too. So I've talked about this in terms of big estrogen swings. So it could be coming off birth control, it could be postpartum, where I kind of got what I would call the cottage cheese legs. This is estrogen. Estrogen dominance definitely weakens the vessel walls. And so there we want to think about supporting our detox pathways with things like DIM, sulforaphane, calcium diglucarate, cruciferous vegetables. Again, making sure that if you are somebody in the years of menopause, like perimenopause, postmenopause, I would be looking at blood work and maybe a Dutch test to really look and see how is my body detoxifying estrogen? What are my genetics saying about methylation? Do I need to be putting in some progesterone or chaste tree, different things like that? I did a story yesterday and I'm going to say it on the podcast again because I just love all of these herbal things out there that are just like, oh yeah, these are hormone balancing. How about we stop lying to people and say that this is hormone supportive? Okay, a lot of the herbs can help, but nothing is going to replace your hormones the way that hormones will. If you want to replace what's been lost because of your age and the decline that happens naturally, you need to replace it with actual hormones. Chaste tree isn't going to help you in your mid 40s, most likely, right? So the other thing that we're going to look at is liver congestion, right? We've talked a lot about this already, but thinking here, how can I support with bitters? My bile flow. Bile gets a little bit more sluggish and bogged down when we have estrogen dominance, what we just talked about. So milk thistle, taurine, choline, trimethylglycine, methylated B vitamins, all those things can help. Make sure that you are supporting your blood sugar levels, right? You're eating an anti-inflammatory diet, that if you are dealing with insulin resistance, you're correcting that through your diet, exercise, and lifestyle. Berberine or inositol could be used here. Balanced B8 is another great product I really like. If you have a lot of food sensitivities or histamine issues, mast cell activation, one of the things that we can think about here is quercetin, nettles, vitamin C, DIO enzymes, a variety of other things that can really help with histamine symptoms if that is something as well, because all of these things that we just mentioned here, these 4 root causes, what are they involved with, or what's the common denominator? Inflammation. Body is not functioning optimally, and that's because there is something blocking the signaling, and that's inflammation for everyone. And so if you want to take a deep dive, right, we can do this with blood work, we can do this with other types of testing, but those would be some of the common denominators that you're also going to see throughout as we get in further to like the edema and cellulite.
Yeah. So spider veins, venous insufficiency, microcirculation issues, blood vessel wall integrity. Those are kind of like the big pieces. Now, edema is basically a general term for fluid accumulation in tissues. So this can be due to heart issues, kidney or liver disease, again, venous insufficiency or inflammation. So a lot of times you'll see this with pitting. So pitting edema is basically you press your finger into it and an indentation remains. So that can affect any part of the body. It's not typically painful unless there's inflammation. So the kind of root issues of this are similar, a couple of differences though. Venous insufficiency is similar. heart or kidney dysfunction is different. So this is where you would be looking at albumin levels, you would be looking at bun levels, you would be looking at sodium, potassium, creatinine. You want to check EGFR levels on blood work to see if there's some type of imbalance, insufficiency of kidney detoxification abilities. But the liver, histamine and mast cell issues, insulin resistance, and hormonal causes can all influence edema as well. So the only real differences that we would say here is like you may want to do higher levels of potassium and magnesium, which help counterbalance sodium-driven water retention, and doing something like a dandelion root tea. So we love dandelion root tea if there's anyone that's dealing with swelling, because it helps as like essentially a potassium sparing diuretic. So dandelion root tea can be great. And then the only other thing that we would add here is nattokinase, which helps fibrin buildup and improves microcirculation. So edema is really just water accumulation. Now, lipedema has to do with a chronic fat tissue disorder. Okay, so this is often hormonal. Many women in perimenopause, I hear this actually a lot from women. They think they're dealing with lipedema. They think it's starting to develop, and it usually is around that time frame of perimenopause, or sometimes post-pregnancy.
If you feel tired all the time and you're drinking water, you're probably missing electrolytes, because you need electrolytes to get intracellularly hydrated. We love Buoy because this is an easy way to get in sodium, potassium, magnesium, and trace minerals into your day without any of the junk fillers that most powders use.
So it's essentially symmetrical. You typically get symmetrical fat accumulation on the legs, hips, or arms. Usually you don't see this in the feet or the hands. A lot of time these people bruise really easily, so it's painful and they bruise. They don't see edema, so they don't see like it, they're not having pitting, but it's resistant to diet and exercise. So they don't see a lot of change with diet and exercise because, again, it's different. This is an inflammatory condition, and it's an inflammatory fat condition. So a couple of things that we would do differently here. You would, yes, do the lymphatic drainage. Compression therapy is really helpful here. So you're doing like flat knit compression garments. You're doing, cryotherapy, or I'm sorry, hydrotherapy, where you're like compression cold therapy. Those boots are really good for lipedema. Red light therapy can help with inflammation and microcirculation. And then nutrients for connective tissue and systemic enzymes. So a lot of times the nattokinase here is also helpful. The collagen and vitamin C is helpful, the magnesium and the hormone balances. But I think in this situation with lipedema, we're looking at a much bigger inflammatory metabolic dysfunction that starts to happen that's hormonally influenced at that time. So there's usually something brewing, and then hormones kind of push it in a much faster direction come perimenopause because we're not detoxing very well. And so a lot of women will experience, because estrogen basically worsens fat distribution, and it can support, during perimenopause, you start to see this estrogen cause a lot of that around the hips, butt, and thighs. And then it turns into like the full legs. So something that's a little bit different about lipedema, but lipedema is definitely something that can worsen and get really hard to reverse. We a lot of times will also use some peptides with it, but at the end of the day, like what I see with the cases that I've had that have been pretty severe lipedema cases, how we're like essentially gotten close to reversing them, you have to fix the metabolism first and the inflammatory environment first. Then we layered in some more aggressive peptide use, and then we layered in hormones once we had the environment in a lot better of a place to balance the hormones, and then things were like tip top, much, much better. So order of importance definitely matters there.
Yep. All right. So lymphedema. So this, when we think about our lymphatic system, this is like 2/3 of the fluid in your body. So it's a huge system, and there's a lot. If you've ever seen one of those charts looking at the lymphatic drainage points and pressure points and all that stuff, it's really, really wild. So this is something that is going to be a little bit more asymmetrical. So meaning you're going to see it in one arm or one leg where you're starting, to see swelling. And a lot of the time, the cause here is going to be blockage of lymph vessels. So think about surgery, cancer, infections, trauma, or congenital malformation. Again, I would say people who are just like stagnant and they don't realize how much that they are needing to support lymphatic movement, and also just not hydrated well to be able to have the fluid that is required to keep things, going. Essentially, we always say the solution to pollution is dilution, yet most people don't even drink 30, 40 ounces of water a day. What we can see is that there's pitting in early stages. It can become hard and fibric later, and then swelling that includes hands and feet, unlike lipedema. So again, differences there. Skin changes, thickening, and increased risk of infection. So this is priority number one, which would be manual lymphatic drainage. Gold standard. You can look up Dr. Perry. He's got the big 6. I've done a few different videos showing that. You can do dry brushing, wet brushing, anything really that's going to get your lymphatic drainage system going. One thing that I always tell my clients too, like if they're having a specific issue, go to YouTube and look that up. And there's going to be some therapist, physical therapist or somebody out there that's going to show you how to do a manual lymphatic drainage massage. So like I've got some that I just recorded last week for like facial manual lymphatic drainage, because a lot of our like clogs in the drain happen at your clavicles. That's the kind of the main point. And then anytime that you are doing any of these manual massages or dry brushing, you're always moving fluid towards the heart, because that's where everything's going to pump through. Compression therapy, rebounding, aqua therapy, swimming, leg elevation, different diaphragmatic breathing. This can be really, really impactful because this can stimulate the thoracic duct drainage. And one of the things that I read a long time ago, I know Becca did as well, we learned it somewhere, but they talked about like the compression of the bra and how much this goes into this chest clavicle. And then the fact that people don't really breathe, they don't chest breathe, like they're very shallow breathers. So that's really important. Again, enzymes can work here as well. So we think about the nattokinase to reduce fibrin buildup. Red light therapy, different fascial work. So this could be cupping, deep tissue work. Once things are, controlled, again, you're going to think about all the other things we've talked about: gut health, anti-inflammatory diet, getting on a low histamine diet if necessary, supporting histamine issues, and liver, gallbladder, all of that stuff. Moving on, we're going to look at cellulite, the one that nobody likes in terms of that cottage cheese leg, right? Or this cosmetic structural change. And again, this is where the fat pushes through weakened connective tissue. So you can smooth this out. I'm going to say I have not seen one cream work well. The ticket here, I would say, and I don't know what Becca all has written down for this, but is autophagy. For me, it was going through autophagy work. Yes, rebounding, lymphatic drainage, stimulating all of that stuff, dry brushing, and just kind of like really supporting, smoothing the skin out. But there's not a magic potion out there or lotion that I have seen that is going to just do the job for you.
No, absolutely not. So cellulite is not, a lot of people think it's like fat. It's not extra fat. It's how the fat's kind of pushing through connective tissue. So it has multiple facets to it. It's essentially the fibrous septae pulling down skin, which gives you this dimpled look. Then it's weak connective tissue and collagen changes. Typically, this happens with estrogen fluctuations. There's a microcirculation and lymphatic component to it. So there's congestion in lymphatics. There's buildup of toxins. There's hormonal and metabolic factors, estrogen dominance, insulin resistance, inflammation. And again, this is why you see it in the thighs, the butts, and the hips, because that is where estrogen causes you not only to gain fat cells, but to push water into those fat cells. So estrogen causes a lot of water retention, and it'll cause you to store more water in fat cells in those areas. And so people notice it in those areas. Sometimes you see it in the belly too. I've seen people notice it in the belly, but it's not as common as the butt, hips, and the thighs. And so, like Liz was saying, 1,000% metabolic. Like this is something that it has the combination of metabolic, and then there's some genetic pieces with estrogen. Some women genetically, when they gain weight rapidly, when they see large estrogen fluctuations, perimenopause, pregnancy, postpartum, you see it more often in that time frame because the large fluctuations of estrogen weaken the connective tissue and also cause lower collagen levels. So this kind of comment on top of the water retention and the fat gain. It's like a perfect storm of when those things happen. And so reducing of the inflammation, insulin sensitivity, and I've seen actually different types of peptides have worked for this. So I've seen GHKCU Glow Blend with BPC and TB500 actually help some while doing other things. So it's not like just that peptide is helping. We're doing other metabolic work. We're making sure that the person is getting into, deep fasted healing states cellularly. But cellulite is definitely something I've seen be able to be like reduced greatly in appearance when you're doing the right things at the right times in the right combination. Like Liz was saying, it's not a cream. It's not dry brushing. It's not these one things that like these one thing that you can implement at a time. It's doing it all together to help kind of reverse that dysfunction with the connective tissue. So understanding cellulite is basically a cosmetic structural change of fat pushing through weakened connection tissue. Lymphedema is a lymphatic problem. So that is a detoxification and lymphatic flow problem. And then lipedema is a chronic inflammatory fat tissue disorder. Edema is a water disorder. You are retaining water. And then spider veins is a venous insufficiency and kind of venous return dysfunction. Now, lipedema sounds like all of these, but it has nothing to do with them. And I wanted to bring it up because I wanted to, like, it again, it's very similar in name, but it has high level of lipids in the blood. So triglycerides and cholesterol, it's a lab work finding. It's not swelling or fat distribution, but I just wanted to clear that up for some people. But peptides we discussed, and briefly, we'll go through kind of how some of these can support. BPC 157 supports vascular repair, microcirculation, and tissue healing. So it can help in like a lipedema affected type tissue. TB 500 improves lymphatic vessel generation and tissue remodeling. So again, lymphedema might be something that TB 500 would be a good thing for. AOD 9604 promotes lipolysis. So in stubborn fat in stubborn fat areas without affecting kind of the IGF-1 growth factor, AOD can help with lipedema and that kind of stubborn fat tissue. CJC 1295 and ipamorelin helps with fat metabolism and collagen production. So that's another thing that could be helpful in some of these situations. ARA 290 is more for neurovascular. So this would be something that I would probably use in more of a venous issue or something where we are seeing like even neuropathy start to happen. And then KPV can be very inflammatory as well if there's like mast cell or histamine stuff going on. So a lot of options that could be used alongside processes, right? So at the end of the day, it is not one of these things that can help. You're not going to fix your cellulite by rebounding on a rebounder, guys. Like I can't tell you the number of questions I have gotten in question boxes about, should I buy a rebounder? I don't know if there's like a trend going on lately with rebounders that are all of a sudden people think that they should buy them. Are they great tools? Of course they're great tools, but that alone is not going to fix a lymphedema or a cellulite problem. It is so much more than that in terms of the inflammatory environment, the hormone imbalances that are going on, the metabolic dysfunction that's going on. And that on top of these tools can be really, really powerful in reversing a lot of them or pulling back the severity of them. And that is what our team can help with because skin conditions and these kind of appearance conditions are typically deeper rooted than you think. So if you want to book a call with our team, see if it would be the right fit, see if it's something that would be good for you. There is a link in our show notes. We would love to talk to you and help. But yeah, definitely something that you don't want to ignore.